As promised, this is the second in the Substance Use and Prevention and Recovery Conference podcast, the SUPRA Conference. I had the pleasure of speaking to Nancy Beste and Steve Wright, who are the organizers of the conference. And I'm going to leave it to a quote from Steve to entice you into listen to this whole integrative response to recovery episode.
Recovery is a building, an active verb, a developing, also an active word, a future that incorporates meaning, hope, and purpose that is specific and personalized for the individual involved. And we can't define it really kind of any more narrowly than that because each individual is different.
Real life for real families. Hurts, habits, and hang-ups happen in every family.
Jerry and I are here with tools to help you trust God, clean house, and tell the truth to ramp up the joy in your family.
You have what it takes.
It's time to become sober on purpose for His purpose. Hello, Sober on Purpose friends. I am at the SUPRA Conference, Substance Use, Prevention, and Recovery, and I have the founders with me, Nancy Beste and Steve Wright, and we're going to talk about how the conference came about and the recovery business that they are running in Steamboat. So Nancy, you want to kick us off and tell us a little bit more about who you are and how you came to this work?
I would love to. Thank you, Tanya. I'm Nancy Beste. I have been doing addiction and pain medicine as a physician assistant and more recently a certified addiction counselor for 20 years. And I have founded with a group of varied specialty providers a pain management organization that was focused on non-opioid pain management in 2006, actually. Over the years, we used quite a bit of medication-assisted treatment, helping people to get off of opioids. And gradually, our business had a lot of people with all kinds of substance use disorders coming in, wanting to have help to recover. And we realized that recovery is not about just medication. Although we can help people detoxify and stabilize with medications, therapy is absolutely essential, the counseling part. And we really were integrated already, but we wanted to make it so that we had the full groups and the full integrated behavioral health services with the medical. So we decided it was time to do a new, more focused company called Road to Recovery. And we started doing that in 2016. We're getting it off the ground. And that is when, this is a long way to get to the answer to this question, but that's when we were provided an opportunity to come to Routt County and through the MAT pilot grant, which is funded by Colorado Senate Bill 74 legislation, we were given the task of coming here and helping providers and the community to learn about MAT and the services that can help people to recover from all kinds of substance use disorders. And that is why I started that long story, because that is where the dollars initially came from to do the SUPAR seminar, because our aim is to help people understand that substance use disorders any of them are medical disorders, and that there are evidence-based treatments that can help people to manage them, and that combined with behavioral health, that's the key to keep them engaged in counseling and in the behavioral health a long time. And that's for lifelong recovery. So when we came here, we noticed that even medical providers weren't really aware of how this whole process works, or that substance use disorders are actually a disease that can actually be managed. And so this is part of the process of helping people in the medical field, as well as therapists and the legal system and probation and the police department. We wanted all people to come together and start to understand that not only is this a medical disease or a disease that can be treated, but that we have to lower the barriers that make people embarrassed or ashamed to come and get treatment. We really have to all be welcoming and all aware that this is just their bad luck that they got this. It could have been diabetes, or not exactly luck, but genetics and environmental factors, and that we should, all provide them guidance to help them to find help and encouragement, and not make them feel embarrassed that they're seeking help, because that's what we all do we all should do to take good care of ourselves. Is if we have a medical disease, we should reach out to a specialist to help us. And so we thought this was the quickest way to get all those people understanding what everybody did, so that people would know how to work with each other and know where different help could be found, so that if they know someone or just happen to casually be talking to someone, they can say, hey, I heard that you can go there and you can get excellent counseling, or over here you can, learn about whether you have HIV or Hep C, or, just all those resources, working together and understanding that it takes the whole community to help people recover. Because once they do finally get the courage to say, yes, I need help and I do have the disease, I want some help, it's a long, hard road, and it goes for life, and they have to keep moving forward, and it's not always easy. So I think that by having all these people aware of the difficulty of that task, they're going to get more encouragement during the process. People are going to applaud their successes. People are going to be more likely to rent places to them, or give them jobs, or invite them into their sober communities, knowing that it's a process and that we're all helping them to succeed.
It has been an amazing 3 days. You put together a fabulous speaker list. What I'm most impressed with is the integrated piece of it. And that's what you touched on. And you're even changing the language. So substance use disorder is the new language for addiction, which puts it in a medical category. Can you kind of, off the top of your head, give the variations of the speaker list that was here? Because it was amazing.
Wow. We had amazing 16 speakers per day, and we tried to include all the resources in Moffitt and Route that are there already available, and let them talk about everything from EMDR and therapy to medical interventions to, we did have the chief of police and Judge O'Hara here talking about the courts. And we were really just trying to highlight the fact that every piece is an important piece in that puzzle. We did also wanted to educate the providers, give them an opportunity here to learn more about it and get continuing medical education for it. Not just the doctors, but nurses and PAs and therapists and pharmacists. And so we tried to get a level of education that was cutting edge with the data about recovery. So we asked, tell me the whole name, prevention,
the Colorado Consortium for Prescription Drug Abuse Prevention.
So we utilized them, and they're a state resource, actually. They have legislative dollars as well, and they have the best panel of experts across the state talking about substance use disorders. So we utilized some of their excellent resources and had those people come in and do cutting edge talks about HIV and some and about women, substance use and trauma, and several other subjects on that nature, just so that even people that were already working in the field would have something new to learn. And Dr. Wright is on that consortium and is one of the experts in the area of pain management and addiction medicine. So we were honored to have him speaking.
Would you tell us your background?
Well, certainly. I think it's useful to look at that because historically I've been through the field now for 31 years, and I started doing addiction medicine 31 years ago when the treatment process was 3 hots and a cot and a little vitamin L, Librium, remember? And then, kind of moving to 12-step. We didn't let go of all of that, but it's certainly developed over time in a much larger array, both with respect to our understanding about the neurophysiology and neuropharmacology of all this, but also the treatment array, the recovery-oriented services, which is the full array of services that we now recognize. And, just looking at how that's exploded over time, I wonder, wow, 30 years from now, what's it going to look like yet again? Because that's really important. Nancy really put this whole thing together and did a beautiful job to put out the array of different services and types of processes, not only incorporating the various threads that had to do with the neurophysiology and why that's important, but also the complement of services that are really important and recognized. I mean, back in the day, trauma was something that happened physically, and now it is central both with respect to emotional, sexual, and physical trauma to the heart and soul of what we need to do and address in addiction treatment. Multiple threads that include not just opioid use disorder, which of course is centrally important, threads that include alcohol, which is probably a bigger problem than the opioids. And tobacco, that's probably a bigger problem than alcohol, but also behavioral addictions, sexual addiction, and so forth. All of these threads really come together and really came together thanks to Nancy for putting this together. And the whole orientation, recovery-oriented, I think is really the important philosophy. And one of the talks wrestled with the concept of what is this recovery? And there's a variety of definitions out there. And of course, it varies from person to person, and it's not a static kind of picture. For me, because I have my own recovery experience as well as working in the field, recovery is a building, an active verb, a developing, also an active word, a future that incorporates meaning, hope, and purpose that is specific and personalized for the individual involved. And we can't define it really kind of any more narrowly than that because each individual is different. And when, in a certain sense, addiction is about a relationship. Addiction is not inherent just in the substance or just in the person. It's inherent in the relationship between the two that incorporates compulsion, loss of control, continuation in spite of adverse consequences. So that really, in effect, needs to be supplanted with a new relationship that has meaning, hope, and purpose, and that has to do with the developing life. And this is where the service piece comes in, and not just throwing any old thing at, the recovery process and hopefully something sticks, but something that is specific and personalized to the individuals that are involved. And that varies as much as we all vary as individuals.
What I saw, and what we didn't mention yet, is there were also recovering addicts, recovering opioid, heroin, all kinds of people, plus people who had been in 12-step programs. I didn't see anybody left out of the party at this conference. There were all people talking together, because what I have seen, and I imagine as providers what you have seen, is the person may go to this provider, may go to that provider, or may be ended up in the jail or the court system or with enforced counseling or domestic violence counseling or something like that, and nobody talks to each other. Mm-hmm. I think the fabulous piece, Nancy, that you and Steve put together today was people were talking, and they were very excited to learn what the other person does. Do you think this is a model that could be replicated? We're talking about Routt and Moffat County. Do you think this is a model that could be replicated for other states, other counties, to get people in services? And how would you see that happening?
Well, I can say that other people have recognized that, and I am so glad you said that. I just have to say this because our whole goal is to get people talking about it and working together and to make it not so this is a secret and that we can't share, because so that I'm so happy that you saw that. The people from the MAT pilot grant were here, and you may or may not have heard that it was just renewed for 2 additional years with a new 001 MAT pilot grant with the legislature just passed, and they're going to expand this system that brought me here. It was in Pueblo and Routt for the last 2 years, and now it's going to be in 10 additional counties in southern Colorado, the hardest hit ones. So yes, they have already said this looks like a really good way to move into a community and help them to understand what resources are there and how they can work together. And they're going to do a similar one in Pueblo sometime this coming year. And I think they're going to try to expand that down into the southern areas. But and the consortium is doing that all the time. That's what the Colorado Consortium's purpose is to get out and educate communities and be a forum for not only what you already have, but what do you need and how can we, give you the resources you need to do that. So I think that we've got a lot of really good education coming down the pipeline in the next years.
I was thrilled to see the wide range of individuals and the wide range of perspectives here. And there's a historical background. There's been a traditional divide between so-called abstinence programs and medication assistant programs that has historical roots actually for decades. And what happened was methadone programs were established in the Northeast of the United States, abstinence-based programs, primarily California-based programs. And so people grew up and both were quite successful. But now how do we sit together in that regard? What I've found over the years, and certainly not just true here, is the 3 most important words in a relationship are maybe you're right.
That's fantastic.
And, when we sit or try to sit down together with folks from the abstinence community and the MAT communities, is that we've got to recognize that indeed value is brought to the table from both communities. And we need to recognize that we need to give a pause on our definitive opinion or so-called definitive certainty about, what is the right thing to do, because recovery experience varies all over the place. For example, I have opioid and alcohol use disorder, and I arrived through the abstinence-based process way back in the day when those other options weren't available. But as a professional, I fully recognize that that's not going to be the way to go for a variety of individuals. And it's not about my recovery experience being necessarily translated into what everybody else ought to do, but what, as a professional, I recognize may be useful for the particular individual involved. The problem with evidence-based medicine is we think of it as the be-all and end-all in certain ways. And when you think of how studies are constructed so that the patients within those studies are meant to be fairly similar, so you can test one question. Well, when they're similar, the person that's sitting in front of me as when I'm a medical provider is not that generic patient that's sitting in that study. They have a whole range of different problems, and you can't just translate evidence-based medicine to every person sitting in front of me. I can get a general idea from evidence-based medicine as to what might be useful, but it's really, really important to personalize. And what we saw here and what Nancy really put together was that wide array. No one therapeutic process applies to everybody by any means, but the wide array of things that we can see how we can assist individuals to move into a recovery process.
What I also saw was not just focusing on the individual, but focusing on the whole system, not just the healthcare system, the court system, the community system, but also the family. It was one of the first times I've been to these types of conferences where they said, yes, we are beginning to recognize in the healthcare system that we're not just dealing with the person who is presenting.
Absolutely.
We're dealing with the whole family. That was one of the most stunning pieces. How did you stumble upon those people who are dealing in that work? How did you stumble upon all these people?
I learned everything we did at this conference from my patients, because I see, since I've been up here, we have about 100 people that are actively in treatment. And what I learned is exactly those things, that everybody has a very individualized need for their recovery. And particularly here, the use disorders are embedded in the families, and it's often hard for them to even know they have a substance use disorder, because it's so normalized in the family they lived in. And we'll just step a little step further. Sometimes it's actually part of how they make a living. Mm-hmm. So it's part of the economics of not just the person coming there, but maybe their parents and grandparents, and it's a normalized thing. And I learned that from my patients, that absolutely, just as we learned here, I hope that over the years we can get it so that we have services that can actually work on all levels throughout a family. But right now, we have to help the people to know we understand that they're going back into a system where the other people haven't yet come to terms with the fact that substance use disorder is a problem, or that, they might have a husband or a wife or a mom or a dad, and what we really try to say to them is, by you changing, you alone, and having boundaries so that you are able to maintain your sobriety, you are going to be modeling for those people around you how much better this can make their life. And I think that through my patients, I've seen that really empowers them to feel like, even if they've already had their children removed by human services, or they've already lost their marriage through this whole substance use disorder, that even if they're not with those people they love, what they do and how they are overcoming their problem can positively impact those people around them. And that really, especially with parents, just empowers them to model for them how they can break that cycle. Mm-hmm. Does that make sense?
Well, and what we haven't talked is, you brought in also some people who specialize in managing children and talking to youth at risk and all of those types of things. So you're not just looking at what's happening now.
No.
But what's coming, especially when we're talking about the opioid crisis. How is that being handled? Those types of things. So what do you kind of envision? And Steamboat Springs in Colorado, we were the first to legalize marijuana. We've got a lot of things going on. What do you envision for the future? Not just the future of this conference, but for the future as Colorado moves forward.
I'd love to find out what your audience would envision, because we'd like to help achieve those goals first. But my personal vision, mm-hmm. Comes from my own family. So we're going to get into the nitty gritty for me. My first marriage was with a person that had alcohol use disorder, severe. I mean, we're talking severe, violent, bad relationship. And, I was that other person that was powerless to do anything about it. And so I left, and I did counseling for my family. But at that time, I wasn't yet trained in medicine. I went back to school after that, but nobody said to me, your kids probably have genetic similarities to your husband, and they've also had a lot of trauma in their life, they might be at risk. Why don't, you should probably do, they never said that to me. So I really literally just thought, I escaped, everything's fine, it'll be great. And then I went back, I got all my medical training, I was working in pain and addiction. Lo and behold, my son, who was an honor student and a great athlete, became a heroin addict. And it just stopped me in my tracks. And then I went, oh, wait, I should have known this was going to happen. And why didn't I when he was little? Because they were 3, 5, and 9 when I left. But why didn't I start right then, preparing them for the fact that they might be at risk? And I didn't. And I should, because I'm medically trained. So that was part of the impetus for me to really move down this path. And my hope is that we'll begin, first of all, to integrate the people and the families of the loved ones of the people that I'm seeing and help them to know, how to help the other family members, especially the people that haven't tried substances yet. Because if they don't try them, they can't get substance use disorder. If you don't try heroin, you're not going to fall in there and have to recover. So if we could so my goal really, and I hope that I can establish that over the next couple of years, is to expand the therapy for every person that comes to us, to their family, to the degree they want to. And we're already doing that with the CRAFT a little bit, which is the Colorado Department of Health's. It's a support group that's for people who have family members that are using, maybe in recovery, maybe not yet, but learning how to live with them. And I think that's a first step to helping them to understand how they can help that person not let their relationship get destroyed, and how they can also look at other people in their family and help them to navigate so they don't end up having to make all the same mistakes that. Yeah, was that a long answer?
That's a great vision, and that's what I saw played out in this conference. And just for the audience, if you are in Colorado and it sounds like this is going to be replicated again, this is for the community too. You do not have to have credentials or be a doctor or anything like that to show up, and the information is invaluable. Because I'm like you, I'm raising 12 and 14-year-old boys right now, and coming from an addiction background, that's our biggest worry, is how do we give you the information you need to make better choices than we did? And
exactly.
Steve, I really hear what you're saying about the divide between the MAT group and the abstinence group, and how do you look at that so that folks can talk to each other and work together and see what works for each person. And we don't have to be at odds to do that.
No, we don't. I actually see the whole field of addiction that's going to upend how we do medicine in general.
Yes.
Overall. And this is what I mean by that. And behind that actually is how trauma is going to change that. In traditional medicine, the way we do this is we figure out a diagnosis. What's wrong? What's the problem? That puts us directly into what's the plan. What we know from trauma-informed processes is that that's a backwards way to look at it and is not necessarily very useful for finding solutions. What's more important than what's wrong with you, is what happened. What happened in that particular process is more important than actually naming PTSD in and of itself. There's utility to naming things, but in terms of the therapeutic trajectory, and we're finding that that's really going to be true in addiction as well. What does that mean? It's not coming from an authority figure that says you have addiction, but it's more like me listening. And in that particular process, health can be better ascertained. And so I see this really upending what we do with chronic disease in general, but more importantly to the issue at hand, how we take care of patients. And how we take care of patients is truly unique to the individuals involved. Sometimes it is an abstinence-based process. Sometimes there is this medication or a variation of medication arrays over time. And certainly looking at trauma, which is such an enormous part of the addiction area, as well as in chronic pain. Both fields, trauma plays very importantly.
Can I just add one thing to
Sure.
that? Because I want to make sure that this point is made, because I love that. And I think that the point is that sometimes the substance use disorders are the way a person copes with all the things that happened to them in their past. And I don't think we mentioned that. So I just wanted to make sure that connection is true, that also sometimes all the symptoms that they're presenting to us with are being self-treated with the substance use.
We're going to have to come back and do the little T trauma, the big T trauma,
Oh, we
all
will.
those things that have to do with that. I know that you all have a dinner to run off to. Tell us where we can find you. And you have the dates for the next year's conference.
We
So
do.
if
And
give
put it
us
on your
those-
calendar.
Yes.
You
Get that.
especially.
I will
June
get
11th through the 14th. And it will again be here in Moffat and in Route. And it may also be in some other counties in this area, because there are a lot of people that want to expand it and include more people. But you can go find information about this conference, see what it was all about, and all the upcoming information about the new one at suparseminar.com, which is SUPAR seminar.com.
And they will have all the notes and all the slides.
Yeah.
Okay, so there were fantastic notes and slides out there. So I really invite the Sober and Purpose audience to go there and look at it. It's fantastic. And we're going to have podcasts along the line. How can they get in touch with you and Road to Recovery and, .com, or how do you do that?
We're at 320 Oak Street in Steamboat, or also down in Lakewood at 393 South Harlan. But if they want to get a hold of us, even to just ask questions about the SUPAR seminar, they can call 970-761-2207, or they can go online to roadtorecoverycolorado.com and get a little bit more information about the different types of providers we have and different kind of services.
Awesome. I want to thank you both for being here, and I really appreciate your time.
Thank you.
Likewise. Thank you.
This is Tanya, and I hope you enjoyed this second episode of the SUPAR conference. As Nancy said, we would love to hear more about what your needs are and how you have experienced recovery. You can talk with us over on the Sober on Purpose Facebook group. In Facebook, just ask to join. It's a private group that we run. Or you can contact me at Tanya@thejoyousfamily.com, or be sure and listen to the next installments of this conference, because there's more really awesome material to come. So again, thank you for listening. Look forward to hearing your feedback and how you like this series. Thank you so much.